It's no secret that cosmetic surgery is on the rise in Australia and worldwide. But what might surprise you is the number of men now undergoing the knife for procedures like man boob reductions, body sculpting and even eyelid lifts. And patients are even coming from the ranks of the blokey tradies sector as well. Today we are joined by cosmetic surgeon Dr Mitchell Kim and two of his tradie patients, Trent and Michael. Fellas, welcome to the show. I guess we'll start with you. So what sort of trends are we seeing in male cosmetic surgery at the moment, Doctor?
Well, the first trend is that the number of male patients coming in is dramatically increasing. And the number one thing that I'm noticing with guys is the bodies. So guys want to look fit, they want to look trim, they want that really athletic look. So liposuction in the tummies to get the six-pack, remove their love handles, get rid of the man boobs. That is the most popular thing that we see.
And they're exercising on top of that, or do
yes.
they just want to take a shortcut?
No, they are exercising, they are eating healthy, they're doing all the right things. But people don't realise that for some people who are genetically predisposed to have these stubborn fat areas, that's not going to help. So they need a little bit of help to get there.
Sorry, but Trent and Michael, you both had surgery done with Dr Kim. Tell me, why did you feel the need to have the surgery, and were there no other options for you to do?
Well, at the time, I've exhausted all my options. I've done dieting, exercising, and this has gone on for years now.
What did you have done?
I had my man boobs done and my flanks up the sides here because there was more stubborn fat. I couldn't get rid of it, and it didn't matter how much dieting, how much exercise, it would not dissipate. And basically, I had to go research it, and this is what I came up with.
And you're happy with the results? And Michael?
Yeah, I just got my chest done and my stomach area done.
What did you get done to your chest?
My chest is get removed man boobs because they excess fat, stubborn fat. Tried training, dieting, exercising, all that. I went to Cosmo and they gave me the solution and it had to be removed.
And do you feel better for it?
Yeah, I feel
Both
excellent.
of you? Yeah.
Oh, fantastic.
I think it's interesting because women have been facing that pressure for many years to feel and look a certain way. So I think it's fascinating that men are now, and I think it's sort of equal. But both you guys are tradies. I think you're an earth remover, yes, and carpenter, Chippy. What was it like going back to work and on the job site? And was there any? Did you tell the rest of the boys? Or
Yeah, I did. My mates thought it was all for females, but I said, look, we're in a new generation, and they're like the wow factor.
What did you do? Rip your shirt off and say, look at me?
Yeah, that's what I did. I said, look, the new Brad Pitt's in town. So when I took off, I was the first one to take my shirt off that day.
Well done.
And what are you spending to kind of become body beautiful?
Oh, it varies, different prices. Obviously, it's up to what you have. So the doctors will do that at Cosmo and they'll work a tailor plan for you.
And would you tell, say, your girlfriend?
Yeah, my girlfriend loves it.
Yeah, she didn't mind?
She thinks Brad Pitt's next to her.
So I have a little boy, and I worry that, he would feel pressure to do this. Did you feel pressure to, or felt like that, you needed to, do this type of surgery to feel accepted, or is it just about making you happy?
It's just making me happy. It was a personal choice. Like I said, dieting and training wasn't working. I was looking at myself at the mirror, and I made the change, and now I feel confident.
would you draw the line there though, or would you keep going?
I'll keep going if I had to change. Yeah.
What else?
Like I want to get my back done and get my, about my cheeks or something, work on that.
Well, Dr Kim, you've had surgery done as well.
I have indeed, yeah.
What did you have?
So I've had Vaser Liposuction to my tummy to get the abs, the love handles and my chest done as well. Regularly get Botox on myself. I'm not ashamed to admit it. Like these boys, I used to train and diet, and these stubborn fat deposits are very hard to get rid of. And if you're genetically predisposed to get it, it's going to be very hard to get rid of just by natural means alone. So
does it stay off though? If it is,
it stays off. Once the fat cells are gone, they're gone for good. So when you're dieting and exercising, you can shrink them, but you can't actually destroy them. So if someone was to naturally lose weight by exercising and watching their diet, yes, they could get to a certain extent, but then it's very easy for them to balloon out again.
What's the recovery time after sort of?
So recovery for normal living after what these boys had done, usually about 2 or 3 days. To get back to full gym exercising, you're looking at about 6 weeks.
But could Trent go back to work earth moving 2 or 3 days after the surgery, surely?
No, probably not earth moving.
I was still bleeding.
Yeah.
Up to your income. Yeah. But we just saw those pictures there. So with that liposuction, you can get those abs. That was like an 8-pack.
Yeah, you can.
That's through liposuction.
That is
Oh
because
God, I need your number. Jesus.
Is liposuction, has it changed over the years? Because I recall that it used to be quite dangerous at times.
So liposuction has evolved quite a lot. And these days what we do is we actually melt the fat first before we suck it out. So it's much less traumatic, you get a much more smoother result, and it's able to tighten the skin. So even if you suck the volume out, you're not going to be left with saggy skin. And that's only available with the Vaser Liposuction.
Well, you're all good-looking roosters, and I think you should stop there because you're handsome as it is. That's what I'm just saying, all right?
You can do it.
You can do that
Can you?
We can.
Careful, Denise, we'll do it as a story.
It'll be a segment.
Maybe Channel 10 should sponsor it.
Dr. Kim, Trent and Michael, thanks so much for joining us on the couch.